Today for Living 808 at Home, we are talking about something very important. It's access to telehealth, and I'm joined by Dr. Robin Matsukawa of Adventist Health Castle to find out what you are now offering in light of the COVID concerns. Doctor, can you tell me what Castle has changed?
So several things in particular. Most recently, we started a drive-through screening. Now that doesn't require any physician order, so a patient feels concerned, they can easily come to the Adventist Health Castle campus hospital and get tested.
And also, as far as access, you make it easier so people don't actually have to come to the hospital and clog up the ER.
Yes, and so we started a telehealth program as well. With the telehealth program, what we managed to do are either use patients' programs that they already have on their smartphone or tablet or iPad. And the other things, so you utilize the programs that like through Microsoft Teams, Skype, and Zoom are some examples.
You're clearly making it easier for people who want to get that information. What tips would you give for someone whether they should access the telehealth versus coming into the hospital or the ER?
So in general, in light of the current coronavirus pandemic, crisis that we're concerned about, is that we want to limit the visits to the ER only for patients who are truly like shortness of breath, you're having chest pains, really feeling unsteady. Those are patients that we want to be in the ER because, again, you're going to increase your chance of exposure to other diseases that you may not have had prior to coming to the ER. So in order to do that, by offering telehealth, so if you have mild symptoms of cough, cold, runny nose, itchy, scratchy throat, you can avoid such exposure in the ER.
Do you have to be tech savvy? Of course, a vulnerable population, the kupuna, they might not be quite as savvy as, say, my kids with the smart technology. How tech savvy do you have to be?
Well, luckily, telemedicine or telehealth is usable by any levels of tech savviness. We have, again, for kupuna who don't have access to electronic or telecommunications equipment, we can use a simple telephone will be available. And then again, for kupuna who do have children who are able to assist them, they can utilize the iPad or their iPhone and use what they call virtual visit, where it includes video as well as audio communications.
How has the response been so far? I know this is relatively new. Are you seeing people starting to take advantage of this?
Yes, actually, surprisingly, a lot of people have started to utilize these appointments that are available. You hear about programs that are like locally created or even nationally created, as long as you have access to a physician.
What conditions can be best served by telehealth? What can be treated?
Best served right now, again, so your basic cough, if you have allergies, if you have that mole and you have a good camera, you can, zoom into the screen. Other things are even high blood pressure management, as long as you have blood pressure or cough at home. If you have a glucometer, maybe your diabetes, and other like chronic conditions. Again, the main goal is that they're stable and that you're not sick enough to warrant a hospitalization.
Now, doctor, after you have a telehealth appointment and you decide it might be worth it for that patient to physically come into the hospital, how do you ensure the safety of them and other people as they come in?
Well, at this time, what we're doing is that we're going to ask some questions over the telehealth machine, and basically, depending on your answers and your need for a physical exam, we'll actually arrange to have you come in physically at any of the clinics and be examined by a practitioner there. And during this time, we will make sure you're wearing a mask for yourself as well as for all the care providers that you'll be in touch with, and to minimize the chance for catching or spreading of the disease.
Right, this sounds like a great option for a lot of people since we should stay at home anyways. What is the best way to get an appointment?
So at this time, as far as Castle providers, you can contact Castle at the number listed, and we'll be glad to connect you with a provider who is utilizing telehealth medicine.
All right. Well, we thank you so much. What a great way to serve our community during these times. And thank you so much for all that you do to help educate and keep our community safe, Doctor.
You're welcome. And thank you for inviting me.
Of course, we'll post all that information for you on khon2.com.